ahead and jump into our session today because we have very little time, believe it or not, and a lot of really great information to share. So first off, I will be your facilitator for this morning's session. I do want to announce to everyone that this session is being recorded. I also want to ask everyone to make sure that they keep their microphones muted. If you want to be on screen and have your face seen, we would love that. As a facilitator and having been on a panel before too, it's great to see faces to talk to versus blank screens. So if you feel comfortable with that, you are welcome to put your video on, but we do ask that you stay muted. Please use the chat box for any questions that you may have, and we will attempt to answer questions that aren't addressed along the way. And if we don't get to them, we will follow up afterwards to get those questions answered and get them sent out to everybody who's registered. You can also use if you're, don't want to do the chat box, you can use the raised hand feature in Zoom and unmute yourself and ask your question out loud. We do have a lot of really great questions. We only have 45 minutes. So we are going to be making sure that our speakers, stay brief with their answers, but thorough to make sure that the audience gets information that they're seeking out. So we will add into our chat the email for the Northern Colorado Health Sector Partnership, so that if you don't get questions up in the chat or asked today, you may follow up and email your questions to the sector partnership and we can get those answered. So welcome everyone to the very first Northern Colorado Healthcare Careers Live Virtual Chat. Our focus today is on in-demand careers in Northern Colorado. This event is hosted by the Northern Colorado Health Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to the changing healthcare environment, solve collective problems, and celebrate successes in our region. So I am Sandra Jackham. I will be your facilitator for today. I am with Larimer County Economic and Workforce Development, and I'm part of the Health Sector Partnership as a support partner. I am going to hand it over to Crystal to introduce herself.
Hi everyone, I'm Crystal Smith. I am the Associate Director of Employee Engagement at the University of Northern Colorado and part of the NOCO healthcare sector. Please, I've put a lot of information in the website or in the chat already. So if you have questions, don't hesitate to type that in and we'll be addressing those. I've also added the email Sandra about, and also the website. So, and we will be planning on posting it on the NOCO Healthcare website for those who can't attend. That was one of the questions. So thank you.
Thank you very much. And we will kick off with introductions from our panelists. So we'll start with Heather. Heather, can you please introduce yourself, where you work, and what role or occupation you have at your organization?
Absolutely. So thank you. My name is Heather Eyrig. I currently am at the North Colorado Health Alliance, and I am based in Evans, Colorado. I have my current title is a Program Project Director for an opioid work group. I oversee a SAMHSA MAP-PDOA grant, a crazy acronym, but we work to get persons with substance use disorder access to medication-assisted treatment, behavioral health, and mental health care services. Prior to this, I'm a nurse by background, currently out of that direct patient care line, but had been executive admin oversight at North Colorado Medical Center, where the Associate Director of Surgical Services. So started this career path about a year ago. Have been a member of the NOCO health sector since that, and am glad to be a part of this call. Thank you.
Thank you, Heather. Can we have Caroline introduce herself, please?
I'm Carolyn Tridenic. I'm currently employed at CSU in the School of Social Work, helping to place our social work interns. But that's a very new position for me. Prior to that, I worked as a medical social worker for Banner Health, both at North Colorado Medical Center and McKee Medical Center for 7 years.
Thank you, Carolyn. Melissa.
Yes, good morning. My name is Melissa Henry. I currently serve as the interim director in the School of Nursing at the University of Northern Colorado. I've been a nurse for over 25 years and in nursing as a CNA in all my different jobs for over 30 years. I've worked as an RN in acute care and community. I've also worked as an FNP in corrections and in different community settings. I'm very excited to talk to everyone about nursing today, and just, right now my current position is in education. I've been the BSN program coordinator for the last 5 years, and just happy to answer your questions, whatever those may be, but welcome.
Thank you. And Katie, could you introduce yourself, please?
Sure. Good morning. My name is Katie Strand. I'm an occupational therapist and the director of therapy. I work with Front Range Therapy Services. We're the group that provides the therapy for Columbine Health Systems. We have 9 permanent staff members on our team here in this building. We provide rehab services, physical therapy, occupational therapy, and speech therapy for short-term and long-term rehab patients. And I've been a therapist for 7 years and a director for 1, and I still get to see patients, which I love.
Great, thank you. And Kristen, could you introduce yourself, please?
Hi, I'm Kristen Files. I am a recruiter at Banner Health. I do all of our nurse recruitment for our 3 Northern Colorado facilities, so CMC in Greeley, McKee Medical Center in Loveland, and then of course Banner Fort Collins there in Fort Collins. So I have been with Banner for 5 years and recruiting our nurses in Northern Colorado specifically for about a year.
So thank you all for being here. We're going to jump right into it to learn a little bit more about certifications or degrees that you hold and where you completed that training or that degree. And I always like to work forward and backwards, so we'll bounce to Kristen. I know you're recruiting for healthcare, but I still think it's important to learn about the certifications and degrees that you hold. So can you speak to us a little bit about your training and degree?
Absolutely. I have my bachelor's of arts and communication studies, and then I'm wrapping up my master's in organizational leadership through CSU. So that is my educational background.
Thank you. Melissa.
I got my RN degree, my Bachelor of Science in Nursing at the University of Minnesota, and then my nurse practitioner degree at the University of Arizona, and my PhD at the University of Arizona. And now I currently teach at UNC. I also am a certified family nurse practitioner, if there are any questions about that.
Thank you very much. Katie.
Sure. I have my bachelor's degree from Appalachian State University in North Carolina. I studied psychology, and then I have my master's degree from CSU in occupational therapy.
Thank you. Carolyn.
So I had a certification in emergency medical technician from Front Range Community College, and then I got a bachelor's degree in sociology. Somehow I missed the get a social work degree in undergrad piece, so I went back and got a master's in social work also from CSU.
Great. Thank you. And Heather.
Sure, and I don't know about the rest of the panelists, but I had my moment of feeling old this morning when I realized I had gotten my BSN like 22 years ago. So my moment of feeling old, but I did that at Baylor University in Texas, and then graduated with my MSN and my MBA a year ago, almost to date, from Grand Canyon University.
Awesome. Thank you so much. And Heather, we'll continue with you. Can you describe a typical day in the role that you currently have, and then speak a little bit about maybe a typical day for an RN as well?
Sure. So my current scope is overseeing addiction and recovery services. I tell applicants all the time, there is no typical day in this field. Each day is different depending on the individual. You have a great plan for the day, and then it goes, 50 shades of gray the other direction that you had planned for. We're working really directly with persons with substance use disorder, engaging at the community level as much so as possible with COVID, but in having those moments for relationship there. I have a team of care coordinators underneath myself, and then have network oversight at 8 different clinics throughout Larimer and Weld County. My current scope isn't so much over a team of nurses, although my program, the director level did require a nursing background. But working with nurses in addiction and recovery services, again, their scope varies wildly too. A lot of it, as Carol can speak to, is probably a lot of care coordination, care management, social work. That is the primary focus of an RN at our level.
Can you, and I'm sorry, can you elaborate a little bit? I think that it would be interesting for the audience to hear why it was important for you to have the RN background in your position.
A lot of us, I'm the initial first call for a program that we have providers calling, we have community members calling. It comes in from a wide range. This is their first touch moment of opportunity to really change their lives around. So I do a lot of the initial screening and triage of people, being that first person from a medical nursing perspective. Are they needing to go, to the emergency department for withdrawal management? Are they stable enough to be in outpatient treatment? Would they require inpatient recovery? So I think that is the medical piece that ties in the nursing background.
That's great, thank you. And then can you talk a little bit about the typical day as an RN? I'm sure it was typical every day, right?
Right. It is, a lot of it is trying to meet the needs of each individual, trying to do at least that medical screening in triage of any of the patients that we have. And then it is really providing services to support them in their recovery. A lot of that is harm reduction and also helping to decrease any barriers to their recovery. So linking them to social networks, getting them linked into any of the barriers, housing, transportation, any of those, large scope of things that can be barriers to their recovery.
Great, thank you. Carolyn, can you talk a little bit about a typical day in your role?
Sure. So I'm going to focus on a typical day in the role of a social worker working within healthcare instead of my current role at CSU, because I think that's a little more applicable. So really, I think it would look very similar no matter what healthcare setting you're in. You typically have some type of a caseload. So that may be patients who are physically in your facility, or it may be follow-up if you're working in a clinic or something like that. But you have kind of a list of patients that have some type of need. So really you're working with an interdisciplinary team. So you're working with nurses, you're working with physicians, you're working with folks in the therapy department. And really the focus for the social worker is coordinating around either access to medical care or really following whatever the care plan is, identifying those barriers that a patient may have, and helping them to navigate the healthcare system, which is really complex between insurance and whatever your medications are, and accessing your physician and your medical care team, whether that's inside a facility or outside. And then a lot of times it's also interacting with that support system that a patient or a client may have. So it may be the family member or other folks within their circle that are also helping to support them outside the medical realm.
Thank you very much. Katie, can you talk a little bit about occupational therapy and what that typical day may look like?
Of course. So when I'm in my role as an OT, my main objective is to support patients with their functional goals, whether that is to be able to dress independently or provide caregiver training with a spouse. Really looking at those subcomponents of what are the barriers towards being more independent and safe. So that may be balance or pain or positioning, endurance, and so on. So I love the opportunity to be creative and engage the patient in something that is meaningful to them while still working towards those functional goals. And being able to involve the whole care team, whether it's coordinating with nursing for someone's pain management schedule, or providing caregiver training with the CNA staff, and things like that. So we also co-treat with physical therapy at times. So if we're working on something more advanced, such as dynamic balance or stairs, things like that, we do get to work with other disciplines. Maybe even working with speech therapy to incorporate cognition and safety awareness too. So having that opportunity that, we're not separate islands, that we do need to, meet every patient where they're at and collaborate as much as possible. And like everybody probably feels, especially now, a typical day, there's kind of no such thing as a typical day. So, your schedule and your treatment sessions are really just dictated by the patient needs, how they're feeling, the status of the building with COVID. Everything is kind of in flux and every day looks a little different, but really supporting patients with their functional goals is our overall objective every day.
Great, thank you. And Melissa, do you think that can you speak a little bit about your experience in the RN world on what that, a typical day may have looked like at that time?
Oh, absolutely. So, I was listening to Heather, and it's so nice to have her speak to an RN role that maybe isn't what people traditionally think of. So as an RN, I started off on a trauma unit in Minneapolis, Minnesota. So we were a level 1 trauma center. It was a step down unit, so kind of in between acute and critical care. And I did that for a number of years. And then I worked as an RN in a community setting. It was a homeless shelter for children in Tucson, Arizona. So obviously the days look very different, but as an RN, the education, either at associate degree or a bachelor's level for an RN, you are looking at your patient population in whatever setting that you're in. You're doing a good assessment, you're developing your plan of care for the day, you're providing interventions, and then you're working with your team to coordinate that care. And so if it's in an acute care setting, if it's a critical care setting, if it's a community setting, that overall process looks the same for an RN. And those degrees kind of give us that big general snapshot to go in as an RN and to meet clients or patients wherever they need. So for me, a typical day as an RN on the trauma unit, was very fast paced. It was coming in, identifying my patient load for the day, going in and doing assessments, developing my plan of care, and then working with those patients and trying to help them through their trajectory of care while we were there. Being on a trauma unit, we had a lot of patients with really severe injuries and after motor vehicle crashes, and so a lot of really complex team needs for those patients as they entered into recovery and then went to rehab. In the community setting, working with children that were homeless, it was similar, but so different in that we were working with these young children who didn't have homes and have parents, and just really trying to provide a lot of that love and support as they were waiting for foster care. When I worked in corrections, it was also somewhat similar, where you're coming in and you're trying to get a snapshot of what the needs are for the day, and then just working with your team to make that happen. I think that's the one thing about being an RN. There's so many doors that are open and a lot of different opportunities for people. So that's been my experience working as an RN. Sorry, I accidentally muted myself. I can share more, if there are other questions too.
Thank you. And Kristen, I'm curious, as a recruiter, I'm sure that you often have gotten this question from folks who are seeking out career pathways in the healthcare industry. Is there anything that you would add to any of the information that was provided about what a typical day may look like in the healthcare field?
No, I think those who live it covered it a lot better than I could, but I think one of the things that I'm frequently asked from those either new grads or transitioning maybe from a non-acute care setting into an acute care setting is is every day, am I going to be on the same unit every single day? And there are a lot of times, especially with COVID, where you might be a nurse on our medical oncology telemetry team, but you may be cross-trained to our progressive care unit or ICU or what have you. So to stay in an acute care setting that every day you're going to be with the same type of patients, I think is that it's just not like that. You'll move around a lot working in a hospital setting.
That's really great feedback. Crystal, do we have?
We do have a question. It's a pretty specific question that I'm unsure about because it's specific to public school setting. Can you speak to the opportunity or process on working as an RN in a public school setting?
Do any of our panelists have any information on this?
I do have some information I can share.
Please.
So for students who graduate from an RN program, either Bachelor of Science or Associate Degree program, if you want to work in the schools, you have to apply through the Colorado Department of Education. And then that form comes to the school, and I fill these forms out almost every day, verifying the number of hours, the settings that the students had in their during their program of study, and then it goes back and then you're authorized to work in the school setting.
Do we have any panelists that have worked in a school setting in a healthcare occupation? Okay. Thank you for that question. And if you need more information on that answer, can you give us that information in the chat? Like, could I have more follow-up? And we'll be sure to get you more answers with regards to that. So one thing that I did notice when everybody was giving an answer, there was a very common theme, and I'm sure that this is something that Kristen heard as well as a recruiter, is that the collaboration and the communication. Every single one of you talked about how it's so ingrained in your entire day, any day, no matter if it's typical or not, that is something that's super ingrained. So I think that sometimes too, being part of an audience and wanting to learn, where's your fit in that industry is understanding some of those foundational essential skills as well, which I heard coming out in the answers that you all provided. So let's talk about the best part of your job. Everybody, you're in that pathway because you have a passion and you love it, but in the role that you're doing now, what is the best part? And we'll start with Kristen on this one. As a recruiter for the healthcare industry, what's the best part of it?
As a recruiter, I have the best part that I frequently get to call candidates and make their day when I'm extending an offer to join our team, or even just scheduling an interview. That everybody is always so excited to talk to me, so I love it. That is the best part, is really getting to help both serve our patients by bringing the right staff in, but also the connection that I make with our candidates and really getting to change their lives when they, get a position that they've always been interested in, unit or facility. So I love it. That's the best part for sure.
Great. Melissa, what are your thoughts?
Well, I never dreamed that I would end up in education when I started my nursing career pathway. But it is so wonderful when I go out into the community and I see the students who have come through our program and just all the wonderful things that they're doing. And you just think about these ripple effects, right, that go out from the work that we do here and how it just spreads out into direct patient care opportunities, work with the community, and just so many wonderful things that our students do is absolutely hands down the best part of my job.
Katie, let's hear your thoughts.
Sure. My favorite thing is when a patient is so happy and proud of their progress, especially when they do get to go home or whatever their prior environment was. Just the feeling of I've come so far after the surgery or illness, and to be part of that process is so rewarding. And we, being in geriatrics primarily now, I love hearing people's life stories. That's definitely one of my favorite parts, and connecting with people that, you know, our society may not typically value as much as other societies. So having this opportunity to spend time with people that have had such different lives than I have and learn from them and connect from them is really fun. And I guess in my other hat as a director, I love being able to have the team aspect of kind of being there to support my therapists so they can give the best patient care possible. Trying to get barriers out of their way so they can just be present and do their jobs. So I also see there's a question for me if you'd like me to answer
that would
it
be,
before I go.
that would be great, Katie, if you could answer it. The question is, what would be the major differences between physical and occupational therapy with regard to patient type and everyday task and goals?
That's a really great question. And patients often ask that too. Family members do. When I was trying to decide, you know, about my career, this is something that I looked at really closely and even debated, well, do I want to be a PT? Do I want to be an OT? So the main difference is occupational therapy is more focused on your activities of daily living. So what do you need to do every day to get through your day and be independent? So being able to get dressed, to use the bathroom, to care for your family, to bathe or shower safely, to get around your house, to be able to complete your job. Physical therapy is more focused on your walking and your balance, whereas occupational therapy is more your daily routines. So I think both are great careers, and you know, you have a lot of variety of different settings you can work in. Typically, our patients do receive both disciplines. So as far as the patient type, we are having you know, patients that are post-surgery, whether that's elective or after an accident like a fall and a, you know, a hip replacement and things like that. Our goals do overlap. So for example, if I'm working on someone increasing their independence with using the bathroom, well, PT is also helping on their gait safety and their balance so they can walk to the bathroom safely. So there is a lot of overlap, but I guess kind of to summarize, OT is more just your daily routines.
Thank you for that. And again, if there's any follow-up questions to that answer, please feel free to include that in the chat. Let's get back to best part of the job, Carolyn, and you let us know what your thoughts are.
Sure. So with social work, we're really looking at people in their environment. So I think part of the best part is just really connecting with patients, people in general, seeing what they're doing positive in their life that's affecting their health, along with identifying anything that might be negatively affecting their health. So it's great if you have a prescription for something, but what else are you doing in your life that might be helping you or not so helpful, and what are your barriers? So really, I love the fact that within social work and healthcare, no day is the same, just like pretty much every other occupation. That you're finding resources. There's all sorts of challenges of navigating these complex systems. So you're really problem solving. And I really enjoy that. And then I think in general, there's just such a wide variety of settings. So as an occupation, I think it's amazing that you can work in a community health clinic or for the health district or a long-term care facility or hospice or hospitals or prenatal care. There's just such a wide variety, and you really, it's teamwork, and you're partnering to help a patient with those pieces that a doctor or a nurse sometimes doesn't have the ability to navigate in those larger systems.
Great. Thank you. And Heather, what are your thoughts about the best part of your job?
Sure, and I'm going to speak to all three of my journeys because both are very unique. My current working in addiction medicine is really being able to have that moment of impact. I never thought in a million years, like one of the panelists said, that I'd be in this field. A lot of times it's a personal connection that brings you into addiction medicine, but really being that moment of impact, like you are seeing people at their lowest of their low, and you have the ability, it's only usually up from there. So being that person that can partner alongside them and change their lives forever, huge. Prior to this, I was over surgical services, like I said, at North Colorado Medical Center. There it was all about the medical team. So I had a team of RNs and CNAs and worked closely with each of these individuals on the panel. It was really that collaboration that you speak to and that communication and being a team to improve someone's health care. And then prior to that, I was an emergency department nurse, and there it was truly, you know, I think our statement was treat them and treat them. You bring somebody in crisis, you know, coming in from a trauma, whatever that might be, and working to stabilize them and get them off, you know, to a hospital floor or being able to discharge them. So those are the three ones I can speak to in the best moments.
I think it would also be important for everybody to hear the hard parts. So let's talk about something that's challenging about the occupation that you're in. And Heather, we'll start with you on this one.
Sure. So the flip side of my current position is you get people that come in and perhaps you are more engaged in recovery than they are. They are, you know, for whatever reason, and so is, you know, substance use disorder, that with being a chronic disorder, they might not be ready for that next level. They may not be ready to invest, or they might relapse, and that can be very hard and emotionally taxing. So I think that is probably the most difficult part. The importance there being really that you focus on your self-care throughout your journey as well, in any aspect of healthcare, really, self-care being an integral part.
Thank you. Carolyn, what are your thoughts on the most challenging part of social work?
Sure. So I think the most challenging part is when you identify a need and there is not a resource in the local community that fits that need. So whether it's something around homelessness or older folks that need extra help in their home, if there's not a way to pay for that or a service that's needed, it's really frustrating to identify a need. Basically you just get creative and kind of figure out how to piece a plan together, but it may not be the most ideal. I think it's also, to back onto what Heather said, challenging when either folks themselves are not necessarily as invested as you are, or they're making choices that maybe you wouldn't with the knowledge that you have, but you're still kind of respecting their ability to make choices as an adult that wouldn't necessarily be supported by a nurse or a doctor or those of us in the healthcare community, but it's still their choice. That's always kind of challenging.
You know, and Katie, what are you seeing in your world as challenging? Did we lose Katie? Yeah, let's jump to, oh, there you are, Katie. Can you talk a little bit with, to us about what's challenging in your world?
Bad internet. Just kidding. Sorry about that. I think changing patterns of maybe unhealthy behavior and maybe wanting progress sometimes more than your patient does can be a struggle if you're working with someone and they don't really want to participate, or maybe they want to go home sooner than it's really safe. And you know, a big part of our job is motivating people, and when someone maybe is less willing than you are to work on some things that need to be worked on, that can be challenging. So creatively motivating constantly.
Thank you. Melissa, what are some of your challenges that you've faced?
Yeah, I would second what everyone has said. In all the different roles that I've held as a nurse, the biggest challenge has been resources. Like, you identify a need, you do your assessments, either again of a community, of an individual or family, and then not being able to tap into the resources that are needed. It's just incredibly challenging and frustrating. When I worked in corrections in particular, I identified a number of needs for that community of patients, and there were so few resources. Again, different time, things have changed since then. That was over 10 years ago. but still, you know, even in education, there's a number of things we identify, but then to try to gather those resources is really tough. But as Carolyn said, you get resourceful, you get creative. Sometimes it opens up doors that you didn't even know existed as you're looking for other modalities for whatever you've identified as your need, but definitely, you know, makes it harder to do the job.
Thank you. And Kristen, what do you find as the biggest challenge in your career?
And Chris-
Twofold.
Oh,
Yes.
I was going to say, Kristen, there's also a question in the chat that might.
The one from Pamela?
Yeah, about how competitive are positions in NOCO.
Okay.
That might align with this challenge.
Yeah. So, skipping to Pamela's answer. I mean, the toughest part is there's twofold. One, it's having to let candidates know that they are not being hired for a position that they are super excited about. But we then have the opportunity to kind of help lay out either find another position that's a better fit for them, or kind of say, hey, you know, go get some more experience, then come back and we'd love to consider you then. The next hardest part, which is in alignment with Pamela's question, is finding the right people to fill positions. NOCO is an extremely competitive area to find positions from a healthcare staffing perspective. So from the hospital side of things, you know, across the state and the country, but specifically in NOCO, there's a shortage of nurses. We have more open positions than we have adequate staff for. So, you know, I mean, to answer your question, it's a pretty competitive market from a staffing perspective. From an employee perspective, that obviously opens up some doors for you because there are more positions than we have folks for. The hardest position to fill, honestly, is some of our critical care experiences. So burn nurses are hard to find because it's such a niche position that a lot of it's emotionally taxing. So it's hard to find nurses that have burn experience and or want to obtain burn experience. And then right now it's tough to find critical care nurses for our ICU and PCU because of COVID. You know, that's tough. They're in really high demand and the need is only increasing. So those are kind of the two areas that we struggle to fill. And then of course, you know, surgical services is always a need for us as well.
Great. And while we're on the topic, can you speak a little bit about, you know, in those higher need positions that you all have to fill, what are some of those critical skills that you all are looking for, or certifications perhaps that you all are looking for?
Yeah. I mean, I think it depends on, you know, what position that we're looking at, but for any of our critical care experience, any of those positions, obviously, you know, we would prefer some critical care experience, but that could even, you know, for a new graduate nurse, that could even come from spending time as a PCA or a CNA on an ICU unit. You know, any of your trauma certs are always great to have for critical care and ED experience positions. So, you know, I mean, I think that outside of possessing experience, the thing that we look for is what sets a candidate apart, what motivates them, what are their values, what drives them to be a nurse, and why do you want to, you know, if we're looking at women's services, why do you want to be a NICU nurse? Why do you want to be labor and delivery? What's driving you? And a lot of the times, it's based upon a personal experience. They had an experience themselves. They had an aunt and uncle that had some sort of trauma, you know, car wreck, whatever, and seeing the nurses care for them has inspired them. So those are the things that really differentiate candidates, is the one who can say, hey, here's my passion and here's why I'm passionate about it.
And I'm going to, feeding off of the answer that you gave, I'm going to toggle over to Melissa, and maybe even Carolyn can speak to this as well, as educational partners. Where would you recommend students gain that work experience, since it seems, you know, from what I heard from Kristen, like an important component in them finding the right matches for some of these positions? Where, as they're moving through their education, can they find those experiences?
Yeah, I can speak to it for the nursing perspective. there are a lot of different opportunities for students, either volunteer or work-related experiences that help students kind of gain the skills and comfort of engaging with individuals in different, settings. And when I do recruiting events with students, or if I go to high schools or we have some events on campus, we talk a lot about getting comfortable in people's kind of intimate space and how important that is as a foundation for nursing. And we just keep building on all of these different skills as people come through their career and however that journey looks for them. But that can come from volunteer, from work experience in the program, working as or during a program of study. If you're working as a CNA or an acute care partner, which some of our facilities have, again, you're able to start building on your skills and adding more to your resume as you go, which is very helpful. But not everybody has the opportunity to do that. And so I always worry saying that because some people are worried that they're not going to come out with everything that they need. And we talk about it's just like your journey, you're gathering it all, and it might just look a little bit different for everyone. But CNA work, acute care partner, any kind of hospital-based or community-based experience is all helpful. I worked as a CNA for 8 years before I finished my Bachelor of Science, and my career took a very different trajectory because of that. Even though all my colleagues, we all had the same degree and we all entered the workforce in that same place, but I felt very comfortable with a lot of my skills because I'd already been doing it for so long.
And to chime in on that, a lot of our students or a lot of our new graduates have a lot of clinical rotations, and that's where they are really, within our system, you have an opportunity to shine for however many hours you are in that unit. And so that's a great way, we hire new grads occasionally into our ICU based upon their senior practicum or their clinical rotations within that unit, which is part of their educational process.
And I would say for social work, I think some of those similar backgrounds that Melissa talked about, so volunteering, working with people, social work is a working with people type of field. And it's not just child protection. There's so much to social work. I think that's what a lot of people think is child protection, and that's not what social work is. So I think if you want to do medical social work, having some kind of exposure, whether that's being a resident assistant at a long-term care facility or a CNA or a medical assistant, or in my case, being an EMT was really helpful to learn all that medical terminology you're going to hear. But I also learned from that, maybe taking somebody's blood was not how I was going to interact well in the healthcare system. So looking for something different to work with people within a bachelor's degree of social work or a master's degree. But at the bachelor's level, like every other healthcare entity, you do clinical rotations. You do 450 hours of an internship. It is required as part of the degree. So that's a great place to get a ton of experience that can then move you forward. And then if you choose to get a master's degree, that same thing. There's a good career trajectory that way.
We do have a specific question about physical therapy and occupational therapy. It's a follow-up question, but I would also be interested in hearing about what experiences would be good for students who are thinking about going into those paths. And then the question is specific. Would occupational therapy deal with patients that have experienced major accidents where they lost complete function of a specific region, and physical therapy would then take over the patient once they have basic function over that specific region? That's the follow-up question. And then I would just be curious if we have some time to hear about occupational therapy and maybe physical therapy as well, and maybe experiences that students could do while they're in school that would help them.
Sure. Just to start to answer the question, I did work in inpatient acute rehab for the first 2 years of my career. So we often did see patients after a motor vehicle accident, backcountry ski accident, and did see severe cases like spinal cord injuries, traumatic brain injuries. And initially, right after that accident, OT and PT both works with the patient because it's a whole picture. It's not just, PT is going to focus on the leg and OT is going to focus on an arm. We need so many functional components to be able to complete everyday tasks. And then the cognitive piece or swallow piece from speech therapy as well. So typically those patients receive all 3 disciplines. And there is constant collaboration between OT and PT, because our goals are so closely related. So it's not really like a staggered OT does this chunk and then PT will do this chunk. It's really simultaneously. And we would work together to create a daily schedule that's best for that patient with what they need. So maybe working with PT first would help the patient be better prepared or in less pain or better range of motion before they engage with a specific task with OT. So it's really just so, there's really not a lot of separation or staggering at all between any of the disciplines. And I kind of speak to the question of students who are thinking about going to school for OT, what experiences they can gain. I think exposure to as many settings as possible is really extremely important, not only to get your hours for your applications, but also to think about what will be the best use of your clinical rotations when you're in graduate school. I really thought in the beginning that I wanted to work with children, and I shadowed in the NICU and realized, like, no way, not tough to do this. I think it's getting as much exposure as possible, and COVID's made it a lot harder to, be able to shadow or volunteer. So hopefully in the spring, when things are better with that, that would be the advice that I would give. And really thinking about not only diversity of population, but orthopedic and neurological. I think seeing as much variety is really helpful and makes you attractive to any graduate school or employer.
Thank you for that, Katie. I think it's great advice, the shadowing and the volunteering, because you might think but you really don't know until you're in that environment and able to at least visually experience what that particular pathway could look like. So that's great advice. And I know we're out of time, but really quickly to round us out, Heather had a few thoughts on soft skill stuff, which we did not really talk a lot about. So Heather, really quickly, can you share some of your thoughts on that, and then I'll close us out?
Right. Sorry, my apologies. So the soft skills are really the most important. Like in your profession, we can teach you how to do the job. It's those people skills. It's that ability to be able to relate, to be able to sell yourself in the first, 5 minutes of an interview, just based on your personality and, how you can engage. Truly focus on that. The rest, these whole panel list of professionals can teach you. So.
Thank you for that. Thank you so much for all of our panelists. I told you the time would go so fast. We could talk so much more, and I have so many more questions I'd love to ask you all, but we appreciate your time in being here. Thank you to all of your organizations for sparing you to be here with us as well. And I want to also thank the volunteers from the Northern Colorado Health Sector Partnership and getting these panels organized and running the show. So we appreciate everybody's time and efforts. For those who are in attendance on the session, that there will be a brief survey. The link is in the chat. We ask that you complete that survey. We will be continuing to do these sessions, hopefully quarterly, maybe just 3 times a year. So we will be doing these again. You will have opportunities to plug in again, but we'd love your feedback to make sure that they're going to be meaningful to you as the audience members. So filling out the survey is the way that you can voice that. And then any other questions that you may have that weren't addressed, please feel free to put them in chat really quick or email the NOCO Health Sector Partnership, and we will get those answers to you, via email since you're registered for the event. So that is all that we have for today. Thank you everybody again for your time, and have a great rest of your day.